So this is a case study of an augmentation rhinoplasty. And what we mean by that is we want to actually augment some of the nasal features rather than reduce them. So in this case study, we have a patient who wished to augment the height of her bridge and also make her tip look more defined. So the underlying cartilages appear like this. And what we want to do is we want to actually project the tip forward by using her own cartilage. And where do we get the cartilage from? Well, we actually take it from this cartilage inside the nose called the nasal septum. So we've schematically removed that cartilage so that I can show you where I take the cartilages from. So what I do is I shape grafts that I'm going to use to augment her tip from her septal cartilage. And this is what we call a shield graft. This is called a columelat strut, and these are cap grafts. And there's actually plenty of cartilage in the nasal septum to make all of these grafts for a person. So once we harvest the cartilage and make the grafts, we can use it throughout the surgery. So cartilage grafts are harvested in most cases from the nasal septum of that individual. We can sometimes take that cartilage from the ear as well if there's not enough cartilage in the nasal septum. Essentially, these cartilages are hand carved and they're shaped to the requirements of the individual patient. In this particular case, I needed 3 types of grafts. I needed 2 very small grafts that we call cap grafts. I needed something called a strut or a columelar strut and something called a shield graft. And I'll show you where I placed those to augment her tip. So once the cartilages are harvested, then we can use them throughout the surgery. Now this is obviously an enlarged view. This is actually real life, assuming that your screen is the same size as mine. This cartilage is about 9 to 10 millimeters wide. So that's the width at the very top. So this would be probably 4 millimeters wide, and same thing for these.